Hi, good morning. I'm Gail Gettins, and I'm a child development specialist and a health communications advisor with the Healthy Homes and Lead Poisoning Prevention Program. And thank you for joining us today. So, our presentation is entitled Childhood Lead Exposure in New Hampshire: What the Data Tells Us. So, just to level set and have everyone understand kind of where our program fits in the larger picture of New Hampshire's Division of Public Health Services. So, the Healthy Homes and Lead Poisoning Prevention Program sits within New Hampshire's Division of Public Health Services, and we're under the umbrella within New Hampshire's Department of Health and Human Services. And a good portion of the funding that underwrites, if you will, the data, the surveillance data that we're going to present today, that funding comes through cooperative agreements, grants from the Center for Disease Control and Prevention. And an important piece to understand is as we get started is that all blood lead level test results. So when a child or an adult goes to a physician's office and has a blood test done to measure lead levels, all of those test results get reported into our office and are reviewed by our clinical team of nurse practitioners, or I should say our nurse case managers. So that just kind of level sets everyone. So much of what we're going to talk about today is the data from our 2021 lead exposure data brief. This is a report, a data brief that we do annually, and to get all the data in and to quality check it and do duplicate it and get it into this format, it takes about a year. So we're always just about a year behind, or feels like we're a year behind, but it takes a year to put all the data together and make sure it's accurate and have it out the door. But this data brief is the focus of this presentation, and some of the trends, dramatic changes we wanted to make sure we had the opportunity to highlight. So you may all recall that in 2018, New Hampshire moved to universal testing by state, change to the state law. What is universal testing? All children in New Hampshire are required to be tested by law at age 1 and again at age 2. So a routine screening, a routine test done during a well child check visit to their pediatrician or medical home, usually done with a finger stick. So you can see that starting in 2015, when we started to put a lot of light on this health issue and some focus, we started to see our testing rates improve. And as we got closer to the passing of the legislation, when there's really an understanding that this change was coming and needed to come, we really begin to see our rates go up. Now, by no means were we anywhere close to, an 80, 90, or 100% where we, of course, would like to be. In 2019, 70% of our 1-year-olds were tested, and only 58% of our 2-year-olds. Now, 58% is a lot better than 27%. But I just point out that we were on the right trajectory, but we still had a lot of progress to go. So this is where we expected our trajectory to continue into 2019 and 2020, and of course, COVID came to our doorstep, and our testing rates plummeted in 2020. And this wasn't a New Hampshire only issue. This was an issue nationwide. Physicians' offices were closed. Everyone was in lockdown. The last thing families wanted to do is take their child to anywhere near a health or medical setting for a good part of the year. So this graph that I have in front of you is figure 2, directly cut and pasted out of our lead exposure data brief. And what this is showing is that it's showing the percent of children, or so the rate of 1 and 2-year-olds who were tested for blood lead levels between 2017 and 2021. And you can see there is this dramatic drop in testing rates from 2019 to 2021. It actually represents a 25% drop, both in the number of children tested and 25% in the rate, the testing rate. So again, this was a big call out in the data brief, that there was a 25% drop in the number of children tested over the 2 years from 2019 to 2021. But think of our small state, that represents 5,360 fewer children who were tested during this block of time. Again, we're a small state. That is a very large number of young children who did not receive this screening. So this again is a figure right from the at a glance, and you can see this shows the same dramatic decline. We have on one side the blue bars represent the number of children tested. The orange line represents the rate, the percentage of children tested. And again, you can see that dramatic decline down to 2020 that just continued into 2021. In New Hampshire, when a child has a blood lead level of 5 or greater, we're required by statute to provide medical case management services and lead investigations. So those are done at no cost to the families. Those are services that are provided through our program, the Healthy Homes and Lead Poisoning Prevention Program. So what you're seeing on the screen is the number of children that are enrolled in nurse case management in our program. So in 2021, we had 184 children enrolled in nurse case management. And this sort of looks like the rainbow bar graph here, but what we were trying to show is the different lead level, the different action levels that the legislature sets in our rules at what testing rate, what result a child has, would they be eligible for the services that we provide. And since the legislation passed in 2018, moving us to universal testing, that same legislation was slowly lowering the public health action level. And it's now set at 5 micrograms per deciliter. So if a child has a confirmed blood lead level result of 5 or greater, our nurse case management and our lead investigation services, if you will, kick in or become available to the families. So this is where we want to spend a little time to make sure that this is clear. Um, in While New Hampshire's public health action level is dependent upon or results from or starts at a blood lead level of 5 or greater, the Center for Disease Control and Prevention sets, if you will, a national or federal blood lead level reference level or blood lead reference level. And in October of 2021, the same year as this data brief, they lowered that blood lead level down to 3.5. So it had been 5 micrograms per deciliter for many years since 2012, but they lowered it in 2021 to 3.5. So what this bar graph shows you, and in 2021, is that we had 430 children in New Hampshire that had a blood lead level 5 or greater. And then when the blood lead level changed from the Center for Disease Control, from the end of October to the end of 2021, we had 37 children who had a blood lead level of 3.5 or greater. So there's your 487 children during 2021 who were above whatever the blood lead level reference level for the CDC was at the time during 2021. You can imagine what this graph might look like in a year's time, as hopefully our blood lead level testing rates are going to rebound or at least get back on the right trajectory. There has been a recall of testing supplies that ended just about a year ago. So as point of care testing, in-office testing has been fully back online, we're going to see these numbers go up dramatically, unfortunately. So this is another, again, this is figure 8 directly out of the at a glance lead exposure data brief. And these next couple slides, I hope everyone really understands and gets the full impact of what this data is showing. So in New Hampshire, children enrolled in Medicaid health insurance products, um, these children should be tested at age 1 and again at age 2 tests. And not only because it's New Hampshire state law since 2018, but it's also federal Medicaid law that these children be tested twice before age 2. So we have our work cut out for us in this area because our children in New Hampshire who are enrolled in Medicaid are not getting tested. And in 2021, what this graph or bar graph on the screen shows you is that 50% of our 1-year-olds in New Hampshire enrolled in Medicaid were not tested. And if we continue and look at the 2-year-olds, it's even more concerning and disturbing. In 2021, 61% of our 2-year-olds were not tested. 61%. And we often say, this is the test. The 2-year-old test is critically important. We don't want all children in New Hampshire to be tested twice at 1 and 2. But if someone were to come to us or come to me and say, we only have this much funding in our community to do testing, who do we test? And the answer hands down is test your 2-year-olds. They have spent the last, 6 to 12 months crawling, playing on surfaces where lead dust collects, putting everything in their mouth, which put them at high risk for ingesting that lead dust and having an elevated blood lead level. In the United States, elevated blood lead levels, lead poisoning peaks between about 18 months and 24 months of age. And that's largely because of their developmentally appropriate behaviors put them at really high risk for lead exposure. So we want our 2-year-olds tested. It's incredibly important that this age group get tested, and we are not getting it done in New Hampshire. So I'm going to spend some time on this graph, and I've cut it, made it a little bigger in the next slide. But what this information is showing you is that not only are we showing you that very few of the children enrolled in Medicaid health insurance products versus private insurance, very few of the children enrolled in Medicaid are being tested. But then if we look at all the children that are tested who have elevations, who, if you will, have been poisoned, who have lead in their blood, the children that are enrolled in Medicaid make up the much greater percentage of those children who are poisoned. So even though very few of the children enrolled in Medicaid, too few children enrolled in Medicaid are being tested, it is in that population that we find or identify far more children who have in fact been poisoned, who have elevated blood lead levels. So I'm going to bring this up a little larger so that so you can see it and understand it a little bit more clearly. So again, well, at least it's on the left side of my screen, you can see that of all the children we test, almost 70% of the children we test have private insurance, and 31% of all the children we test are enrolled in Medicaid. So more or less the Medicaid children are not getting tested. They're just a small percentage of all the children who are tested. But on the flip side, at least what's on the right side of my screen, you can see that amongst the children with private insurance, the 40% with the blue line there, the 39.7%, amongst the children with private insurance, sure, we certainly find children who have elevated blood letters who've been poisoned, but it's far lower than the number that are actually tested. And you can see if the number of children who are enrolled in Medicaid, 60% of the children who are poisoned, who do have elevations, who have lead in their bodies, 60% of those children we identify are enrolled in Medicaid health insurance products. So in essence, I hope this screams out to you. We're not testing a very high-risk population. We're not testing a population where most of our children who are poisoned, who are coming in contact with lead, are. That's what these bar graphs show you. So where do we need to focus our efforts? Where are children getting tested? Where are children not getting tested? Where are we seeing are more children or populations, higher numbers of children who have been exposed to lead that have elevated blood lead levels? In our data brief for the last few years, we have put in these maps of the state, and these outlines are the SAUs. So, your school districts, your SAUs, and the numbers that are on these. Sometimes people ask if those are numbers of children, and no, those are the numbers of the SAU. So for instance, I live in Concord, I'm SAU 8. If you're in Claremont, you're in SAU 6. So those are what the numbers are identifying, which SAU. And you can see that what this shows us is the areas where children are tested, the percent of children that are tested for blood lead levels in figure 4. And in figure 5 shows you by SAU where we have children who have a blood lead level test of 5 or greater. The reason we put both up is because you have to make sure that an SAU that perhaps does not have a lot of children identified with having elevated blood lead levels, you have to make sure that that's also not just because that SAU has very low testing rates. You may not be finding any children with blood lead levels, but that may be because you're not testing. So this is why we have this information. But again, the screen just before us, I've just cut it, if you will, and made it larger for the next 2 slides. So this is figure 4, and this shows you the percentage of children under 6 who are tested for blood lead levels by SAU in 2021. So you can see we have some communities that do a really good job with testing, and we have other areas where the testing really is not as robust as it needs to be. And figure 5 shows you the SAU map again, but showing you the areas or the SAUs with the number of children with blood lead levels greater than 5. And you can see that for 2021, just 2021. So you can, there are certainly some areas that you can see there's a much higher number of children with elevated blood lead levels. So we changed up our data brief this year to create a page that's really action needed. Your action is needed. We are in a situation in New Hampshire, and many states are in the same situation post COVID and post recall of testing supplies to perform tests, blood level tests on children with just the finger stick and in the office. We had two variables, two factors come together that have really negatively impacted our testing rates. And we really need to have concerted, collaborative effort, focus on what's needed to make sure this trajectory changes and to make sure our children are tested at age 1 and age 2, so we can protect their health. So the actions needed, we need to get every child tested at age 1 and again at age 2. And we need catch-up testing. Children who are ages 3 to 6 who maybe weren't tested at all or didn't have a second test, the same way we're putting focus on catching up with children's immunizations post-COVID. We need to make sure our children get catch-up lead testing as well. We need to make sure that our children who have elevated blood lead levels, who have a blood test result of 5 or greater, get referred to early support services. Make sure they have a developmental screening, and to make sure that we're connecting them with services that can help mitigate the impact of the lead exposure. So we can be proactive in giving them all the supports early on, hopefully mitigate and reduce the impact, the long-term impact of the lead exposure on their developing brain. And we need to identify where the lead sources are. Where in the child's home are they coming in contact with lead? And if not their home, their childcare situation or their grandmother or relatives or friends or neighbors, where are they coming in contact with lead? Again, in New Hampshire, it's almost exclusively lead paint dust, dust from old paint that's either just deteriorating on its own or disturbed during renovations and repairs. It's that dust almost overwhelmingly that is the cause of lead exposure in New Hampshire. But we need to identify it, those sources, and we need to take steps to obviously get the child away from that exposure and limit or end any future exposure. So the data graphs that I've just discussed with you came from our statewide lead exposure data brief. But we also, if you will, break it down on a more local or regional level using the public health networks in New Hampshire as kind of the areas that we break it down by. So we have regional lead exposure data briefs with specific maps and tables specific to that region so that you are able to get the same data we were just discussing. So numbers of children tested, number of children with elevations, and what those changes in numbers have looked like over the last few years. You are able to get that data by your region, which is right down to the town level. And these are posted on our DHHS data portal. So I'm going to turn, if you will, the screen, and I'll be the one moving the slides along. I'm going to turn the presentation over to Nicole Carlson. I'll let her introduce herself, and Nicole will talk about blood lead levels in adults in New Hampshire. Thanks, Nicole.
Thank you, Gail. I am an environmental health analyst with the New Hampshire Environmental Public Health Tracking Program in the Division of Public Health Services here. And one thing I work a lot with is exposures in the work environment. So I'm very happy to be able to support the Healthy Homes and Lead Poisoning Prevention Program in their work with adult lead exposure. because what we know from the national level, nationally estimates suggest that as high as 90% of elevated adult blood lead may be work-related. And
Move along. There you
move
go.
along, thanks. Since Gail has been talking today about childhood lead, I want to start with a very quick introduction to the kinds of values we typically talk about in adult lead, because they're much higher. This chart is from the National Institute for Occupational Safety and Health, and I wanted to point out a few values here that I've circled within orange. And that's per OSHA, you're allowed to work with a blood lead level of 40 micrograms per deciliter. And OSHA's action level for triggering a worksite inspection is 25 micrograms per deciliter. But I do want to point out here the recommendation that pregnant people do not exceed a blood lead level of 5 micrograms per deciliter. And next slide, please. You may not be familiar with the symptoms of lead exposure in adults, so I've listed some of them here. And I'm not going to read them all to you, but at a glance, you can see that they're pretty diverse. And as you can see, most of these are not specifically flags for that would jump out at you for elevated lead level, particularly when you look at symptoms of chronic exposure. Things like GI symptoms, impact on mood, fertility issues, even increased blood pressure. This highlights the need for medical providers and public health professionals to be asking people what they do for work. Next slide, please. Thanks. And there's another reason that we care about adult blood levels beyond what happens in the bodies of adults, and that's what's called take-home lead. And that's pretty much what the name implies. Adults who are exposed to lead at work or in a hobby can bring home lead in their home or their family car or on their clothes, shoes, hair, body, or personal belongings. And that's a pathway that children have been known to be exposed to lead by. To avoid exposing children, there needs to be a concerted focus to reduce work exposures, and when not possible, to isolate those work exposures separate from your out-of-work life. So what do we know about adult blood lead levels specific to New Hampshire? We recently finished an analysis of the adult data from 2013 to 2020, and I'm going to share some of that. And the first thing that I should mention here is that we use the term adult data here, but because this is so heavily linked to work, the national best practice is considered to start at age 18. I mean, sorry, age 16. And so it's 16 and up. And while there are a few hazardous jobs that are explicitly restricted from workers under age 18 under the Fair Labor Standards Act, workers 16 and up are generally allowed to be employed in many jobs in potentially hazardous industries for lead exposure, including construction, manufacturing, and working around ammunition. And so as for our New Hampshire results, each year during this time frame that's covered by this data analysis, we have about 2,000 to nearly 3,000 individuals tested. And the first thing I want to point out is how heavily dominated the high blood lead levels are by men. While only about 72% of the individuals tested each year were male, over 90% of the cases each year above 5 micrograms per deciliter were male. And that climbs even higher to about 97% of the highest elevations that are above 25. The average count of adult cases each year is shown in this table, with roughly about 200 cases per year of elevations above 5 and dropping down to about 20 per year for the highest bucket of 25 plus. I should have a small disclaimer that the year 2020 is included in here, and obviously that is different patterns for employment and also for testing. For the adults that we had occupational information for, the 4 industries with the top counts of elevations above 25 micrograms per deciliter were construction, followed closely by manufacturing, Then a little gap to waste management and remediation, and finally a category that's called other amusement and recreation industries. And if you're trying to figure out that last one, I can tell you that that subsector includes establishments like shooting ranges. And my final disclaimer that I should mention is that all of these results for New Hampshire depend on who actually gets tested. Unlike in children, adults do not get routine blood lead testing. Very often, these tests happen because an employer is subject to OSHA requirements in certain particular private sector industries that are known to have high exposures to lead. Once again, as I mentioned earlier, if medical providers are not asking detailed questions about patients' employment and checking to see if they are already tested through their employer, they would not routinely be ordering a blood lead test. So as I mentioned, we've recently completed a whole analysis on this adult data, and I didn't want to take too much of your time today, but if you want more information, please feel free to reach out. Thank you.
Thank you, Nicole. The take-home piece that Nicole mentioned is real, and it's certainly, as she said, a route for how some children in New Hampshire are exposed to lead, and all children, not meaning it's not just New Hampshire specific, but coming home on that lead dust can come home on phones, cell phones, and um, car seats in the truck, children's safety car seats in a truck, and clothing when you come home and hug your children. And certainly, she mentioned at the end gun ranges, shooting ranges, and especially indoor rangers are can those that are participating in an indoor gun range can have that on a lead on their hands and their clothing as well. So thank you. So on the screen now is the contact information for me, Gail Gettins, Nicole, and our section administrator for the Healthy Homes and Environment section is Beverly Druin, and her contact information as well. And all of the data that we spoke of today, the data briefs statewide and regional, are posted on the DHHS website. Thank you so much for participating today.